Hi, my name is Maria Fayetete, and this is Nursing 612, my head-to-toe physical exam. This is my patient Amanda. Before she arrived to this room, we had her empty her bladder. We got her height, weight, and vital signs. I did the distance vision chart, and she's in a gown. Hi, Amanda. My name is Maria. I'm going to be your nurse practitioner today. We're going to do a whole head-to-toe assessment. So first, I am noting her skin color and making sure that it's even. She doesn't have any moles or nevi. I'm also noting her skull for symmetry, her eyes for symmetry, ears, making sure that they're equal distance apart. And now we're going to assess some cranial nerves. I'm going to have you clench your jaw, squeeze your eyes tightly, wrinkle your forehead, puff out your cheeks, smile, and stick out your tongue. And say ah. Ah. Okay, so we assessed cranial nerve 7 and cranial nerve 12. Now I'm going to palpate her scalp. I'm noticing for any kind of deformities or any kind of pain, making sure her scalp moves freely from her head. At this time, I'm also assessing her hair to make sure it's the texture and the color, noting any signs of hair loss, and the texture. I'm going to palpate her facial bones again, feeling for any kind of pain, any kind of deviations from normal. I'm going to assess her TMJ joint and have her open her mouth and close. Perfect. I don't hear any popping, clicking. I don't feel any locking. I don't feel any crepitus. I'm going to assess her sinus regions, her frontal sinus, and her maxillary sinus for any kind of pain or any kind of swelling with that. We're going to assess her light sensation. So I'll have you close your eyes. This is soft, this is sharp. So go ahead and tell me, soft or sharp?
Soft. 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 Sharp. Sharp.
So it's even, so that's great. So next we're going to move on to inspecting your eyes. I'm going to have you close your eyes. I'm looking for equal eyelids and making sure there's no redness, swelling, making sure eyelashes are flare up and out. I don't notice any crusting. I'm going to have you open your eyes. I'm going to look at her sclera, make sure that it's white, and it looks white to me. I'm going to look at her conjunctiva, which is pink and moist on both sides. I don't see any kind of erythema or any kind of exudates. I'm next going to palpate her lacrimal apparatus, noting any kind of pain or swelling or any kind of drainage coming out, which looks normal to me. Next, we're going to do a vision screening. We're going to do the Rosenbaum pocket chart. So I'll have the patient hold this 14 inches away, and she's going to read the lowest line that she can.
93786.
Perfect. So it looks like she's got 20/20 vision. Wonderful. Next, I'm going to look at her pupils and make sure they're equal, round, and reactive to light and accommodation. So I'm going to have you stare up at that red mark. I'm going to look at her pupils and make sure that they react. That's direct. And now I'm going to look consensually, which they look equal, round, and reactive. Next, we're going to do the cover-uncover test. I'm going to have you cover one eye, have you stare at the ceiling again, and I'm going to have you uncover this eye, and I'm going to look for any kind of strabismus, any kind of cross-eye motion, or any nystagmus, which I don't see. So go ahead and do the other eye, and uncover. Perfect. So there's no strabismus noted. Next, we're going to do the red light reflex, which you take the ophthalmoscope, which you guys obviously won't be able to see me do this, but the lights are dim, and we're going to look inside her fundus of her eye, and I do notice a red reflex on both eyes. So that's good. I don't see any opacities. Next, we're going to do we're assessing our visual fields for extraocular movements. So I'm going to have you go ahead and follow my finger. So I'm looking for any kind of nystagmus, which looks normal to me. So next I'm going to inspect her ears. I'm going to inspect the alignment of her auricles, making sure that they're even, if they line up with the outer canthus of her eye. I'm going to note her, making sure that they're equal. I'm going to palpate her auricles, noting any kind of tenderness, swelling with that. I am going to now I'm going to assess her hearing with the whisper test. So I'm going to have you go ahead and plug one ear. And I'm going to say 3 words. I want you to repeat them to me.
Cat, dog, horse.
Perfect. And opposite?
Beech tree, cat.
Perfect. So that looks normal to me. We're going to do the Rhine test now, where I'm going to assess her bone conduction and air conduction, which air conduction should be twice as long as the bone conduction. So I'm going to, this is the Rhine test. Tell me when you can't hear it.
Okay. Okay.
Perfect. That one's a little different. Okay, we're going to do the other side.
Okay. Okay.
Perfect. So that looks like it's about 2 to 1. So it looks like her hearing's normal, which is the cranial nerve 8 is what we just tested. Now I'm going to inspect her ear. I'm going to look at the external ear canal, making sure I don't see any kind of redness or any kind of drainage. I'm also going to look in at her tympanic membrane, noting the color. It looks pearly gray, and I do see a positive light reflex. I'm going to do the same on the other side, looking at the external canal, and then I'm going to look in for any kind of redness, exudate, swelling, any kind of signs of infection, which looks normal to me. I don't see any cerumen noted. Next, we are going to inspect the nose. I'm going to look at the structure, make sure that the septum's even, and the position of her nose is in the middle of her face. I'm going to determine the patency of her nostrils, so I'm going to have you plug one nose, breathe in and out. That one appears to be clogged. Let's do the other one. Perfect. So it looks like she has some kind of inflammation going on in her right ear. So next I'm going to inspect her nose. I'm going to observe for any kind of, I'm going to look at the nasal mucosa. Change the speculum out real quick. And I'm going to look to see if it's pink, moist, making sure it's not boggy or bluish, which would suggest that it is, she has allergies. It looks pink and moist, so that's good. And that looks pink and moist as well. Good job. The terminates don't look bluish gray, so that's a positive. Next, I'm going to inspect her lips, looking at the outside, make sure that they're even. I don't see any kind of crusting or any kind of cheilitis noted. I'm going to have you open your mouth. That looks pink and moist to me. We're going to inspect the gums. So I'm going to take my stick and just look at her gums here, making sure that they're pink and moist. Let's see here. They feel firm. They feel tightly bound to her teeth. They're not loose or anything like that. I'm going to also inspect her teeth, noting for any kind of caries or cavities, any kind of breakages noted. No signs of infection. I'm going to have her tilt her head back, and I'm going to look at the hard and soft palate, which looks even. I'm going to look at the tongue. I'm going to assess the color and the symmetry and the shape. I'm going to have you stick up your tongue, and I'm going to look at the floor of the mouth. Good. I don't see any swelling or anything like that noted. Next, I'm going to look at the anterior and posterior pillars of her mouth. So go ahead and open your mouth and say ah. So I notice the anterior and posterior pillars of her mouth are equal. Her uvula is midline and center. Her tonsils look about +2, which is normal for her. I don't notice any mouth odor or anything like that, and it's all pink and moist and glossy inside. I'm going to have you say ah.
Ah.
So she does have the cranial nerve 9 reflex elicited. Next, I'm going to inspect the neck for symmetry. I'm going to look at the smoothness of the neck, making sure that her sternocleidomastoids come center to the trachea. I'm going to palpate her thyroid and have you swallow. So the thyroid does move when she swallows. I'm looking also for any kind of signs of JVD, which I don't see any signs of JVD. I'm going to have you shrug your shoulders. That's cranial nerve 11. Do it again. Perfect. Now I'm going to assess her range of motion of her neck. So go ahead and look down, look up, look side, look the other side, ear to your shoulder, ear to your shoulder. Perfect. Again, down, up. Perfect. Look toward your head. Turn your head towards the other way. Perfect. Ear to shoulder and ear to shoulder. So that's pretty even. So now I'm going to do passive range of motion, which we obviously know she can do. And ear to shoulder. Perfect. So that all looks normal to me. Now I'm going to assess the carotid pulses. I'm going to do one on each side so we don't make her pass out. And they feel equal to me. Okay. And now I'm going to assess the lymph nodes. I'm going to go from the occipital, posterior auricle, preauricle, parotid, submental, submandibular, superficial cervical chain, posterior cervical chain, superficial deep cervical chain, and supraclavicular. Then I'm going to do the inferior clavicular, and I'm going to have you open your arms, and I'm going to do the axillary too. And I'm trying to note for any kind of firm nodules or anything that's hard and doesn't move. Next, I'm going to auscultate the carotid arteries. I'm going to use my bell of my stethoscope to do so. So I'm going to assess one at a time again. And I'm listening for any kind of bruise. And I'm going to have you hold your breath. And I'm listening to her thyroid as well to see if I hear any kind of bruise, which I don't. So next I'm going to inspect the hands and her arms. So I'm looking for symmetry, noting any kind of deformations or swelling. and the skin looks even to me. I'm going to assess her nails and make sure that they look even and I don't see any signs of infection. I'm going to assess her radial pulses, making sure that they're even and palpable, which they are. They're about +2, +3. Next, I'm going to do her brachial pulses, and they're even as well. Next, we're going to do the lungs. So now I'm going to have you swing forward, and I'm going to inspect her skin on her back, which it looks even. I don't see any moles or any kind of malformities. I'm also going to palpate her thoracic configuration. Any pain?
No.
No pain. It feels pretty even. I'm going to percuss the CVA, tenderness. Any tenderness? Perfect. So next I'm going to inspect her respirations and make sure they look equal, which they do. I'm going to have her take a deep breath. So I'm going to feel her expansion at the 10th rib. Take a deep breath in and out. Perfect. I don't feel any crepitus or anything like that. Now I'm going to do tactical fremitus. I'm going to have the patient say 99 as I systematically percuss or feel down her back.
99, 99, 99, 99.
So I don't feel any kind of decreased or increased fremitus noted. Next, I'm going to percuss the posterior chest. So I'm going to percuss, make sure I hear resonance over all the lung fields, which they sound even. And I want your arms up to your side. We're going to do laterally. Comparing both sides. And they sound even to me. Next, I'm going to do diaphragmatic excursion. So I'm going to ask the patient to hold her breath while I percuss down to find the from resonance to dullness. Hold your breath. Okay, I'm going to mark that right there. You can breathe. And as she's exhaling out, I'm percussing up again to find resonance to dullness, which is right there. So I'm going to measure this, and if it's under 10 centimeters, then that's normal. So we'll do that to both sides to make sure that that's normal. Next, I'm going to auscultate all of our lung fields. We're going to start posteriorly. So deep breaths in and out. Perfect. So I'm listening for any kind of crackles, rhonchi, arms up. Perfect. Okay, so now I'm going to have the patient sit back, and now I'm going to inspect her chest and look at the color, again looking for symmetry, noting any kind of differences. I'm looking at her respirations, making sure that they're even, they're unlabored. I'm looking at her effort, her depth. I'm going to now palpate the chest wall, noting any kind of crepitus or any kind of pain. I'm looking for thrills. Or feeling for thrills, looking for heaves. I'm going to locate the apical pulse, which is mid-clavicular line on the fifth intercostal space, which is hard to do on a female, but it's about right there. We already did the infraclavicular and auxiliary lymph nodes, so we're going to move on. I'm going to percuss the anterior chest. We already did the posterior and lateral, so we'll do the anterior. Again, listening to resonance. So that sounds even. Next, I'm going to listen to her breath sounds anteriorly. So go ahead and take some deep breaths. Perfect. Okay, now I'm going to listen to her heart. So I'm going to start with aortic, pulmonic, Erb's point, tricuspid, and then mitral. Perfect. I don't hear any murmurs. Whistling, rubs, anything like that. Next, I'm going to look at her abdomen. Lay it flat here. Okay, so first we're going to inspect. I'm going to look at the, oops, that's not my pen. I'm going to look at the contour, noticing any kind of differences, any kind of pulsations or heaves, which I don't see. I'm going to look for smooth, even movement. I'm going to auscultate next all four quadrants for 5 minutes if I don't hear anything. So she's got active bell tones. I'm also going to listen to her aorta, renal arteries, iliac and femoral arteries. I'm going to listen with my bell. That's the aorta. and the renal, iliac, and femoral. Okay. Now I'm going to percuss, again, all four quadrants, listening for tympany, dullness over organs. Okay. I'm going to also, next I'm going to move on to light palpation. So I'm going to ask the patient if she feels any pain. Any pain? No pain. Good. Doesn't listen to any pain. I don't see any guarding like that. So we're safe to move on to deep palpations. So I'm going to do her liver. So I'm going to start on the right costal border. My left hand's going to be underneath the 11th, 12th rib, and my right hand's going to be up on the same area, kind of pressing downward, so I can move the liver forwards. Take a deep breath in. So I feel her liver right there. Another way to do it is through percussion to find the marks of dullness. I'm also, while I'm here, I'm also going to palpate the left kidney, which you normally aren't able to feel. And then I'm going to do the right side again. I'm going to palpate for her right kidney and then her spleen. Okay. Any pain with any of those?
No.
I don't see any kind of rigidity or guarding. Noted. I'm going to also palpate for the aortic pulse, which is right here. And then I'll just make sure that she's got sensation in her stomach. So that's great. So next we can put your shirt down. We'll have you sit up here. Oops, sorry. And so now I'm going to inspect her legs. I'm looking for symmetry. I'm looking for a hair distribution, any kind of swelling like that. I'm also going to be feeling her, looking at her muscle mass, make sure that it's even. I'm feeling for the temperature, which is warm, it's dry. We'll assess for edema. Looks like she does not have any edema. I'm going to assess her pulses. First, her dorsalis pedis pulse, which are even. Her posterior tibial, right there, perfect. And then a popliteal. Perfect. All right, so now we're going to move on to reflexes. So I'm going to do the brachial reflex. So I'm going to have her bend her arm slightly, and then we're going to just right here. Perfect. It's kind of, this one's kind of hard to elicit, but so we're looking for a muscle contraction. Perfect. All right, so I'm going to have you go ahead and swing your legs. Oh, that's, yep, swing your legs right there. So now we're going to do the knee for reflex. Okay. You can relax. Ready? So there's a little bit right there. Okay, so now I'm going to do her Achilles tendon. So we're going to look for any kind of she'll point her toe. So we're making sure that she doesn't have any clonus, which I don't see. There we go. All right. So now I'm going to have her stand up and I'm going to assess her lumbar spine. So again, I'm going to feel down. I'm going to have you go ahead and touch your toes. I'm looking at the curvature of her back, which looks to be straight. And then I'll have you stand up. Any pain with any of that?
No.
I don't feel any cracking or anything like that. Then we can, I think that's it. We did all the cranial nerves throughout our whole exam. Thank you guys for watching, and awesome, thanks.